The funeral industry is struggling to keep up with the rapidly increasing death toll caused by the coronavirus pandemic. Already, around 11,000 people have died from the virus in the United States, and tens of thousands more lives are projected to be lost. The numbers have created an unprecedented bottleneck at morgues, funeral homes, and cemeteries.
And Graham, Kate spoke to several funeral directors in New York City, which is the epicenter of this outbreak here in the U.S. And Graham, you're joining us now. Graham, I remember, I think maybe it was last week or a week ago, the president talking about Elmer's Hospital in Queens that he was really familiar with. And he saw a video of what he described as body bags lying in the hallway and freezer trucks coming in because of a morgue overflow. And you could really tell that he was rattled by those images. But after those body bags leave the hospital, they have to go to area morgues, they have to go to area funeral homes. How are morgues and funeral homes in New York coping?
They're overflowing. Think of funeral directors as the end of the front line in terms of those who have to directly interact with people who have caught the virus and who could still potentially pass it on through like respiratory microbes. And they're saying we have more cases than we can handle. And just like in the hospitals, we're running short on personal protective equipment. And they point out, funeral directors are going to be the last in the line of those frontline workers to get that equipment because it's so important to get it to medical workers first.
And Graham, funeral homes are also enforcing social distancing. How is that changing the nature of what they do?
One said to me that the business model has completely changed. In many cases, the bodies are going straight to a crematorium or straight to a grave without there being any chance for loved ones to be able to go and pay their respects in the way we think of, like standing in front of a casket and taking the time there. And then in other cases, when there is able to be a service at a funeral home, there are these kind of strict rules that have been put into place. Maybe it's shifts, so 4 or 5 people can come at a time, and then the next 4 or 5 people. And it all has to be very orderly and very supervised. And then, of course, there are virtual services, so that's people gathering over Zoom or FaceTime, but not getting to do that personal service that we're used to seeing. And for the funeral directors, they said that's actually really hard. They pride themselves. You don't get into the funeral business if you're not trying to give people like a really good chance to grieve in the way that we've come to expect. And right now they have to say to people, we can't do it the way maybe you expected to be able to do it for this person, or that person may have hoped to have had, but we have to make the best of it right now.
Yeah, I think it's a really good point to bring up, Graham, that for funeral directors, sort of managing and taking care of the body is one thing, but they also really, really focus on being supportive, of being honorable, of sort of stepping in when, perhaps a family is falling apart and being a steadying, stabilizing force. And much of that has to do with probably, sort of being intimate, touching someone, hugging them when they need a hug, giving them a handkerchief when they're crying, and they can't do any of that stuff. And then there is just sort of the basic kind of, like I said, managing the bodies, but sort of the basic things that you need to do, like finding a place for the body to go. Cemetery plots. Are there enough cemetery plots?
So I don't actually have a number on the number of cemetery plots in New York, but what we do know is that they're coming in so fast that yesterday, for instance, they were talking about, well, we have to create temporary internment sites. And there was some argument between officials about whether that'll happen. New York City actually has an island that over the course of about 2 centuries, they've used as like a potter's field. And this would be the first time that it's not just for like unidentified people. They would be talking about using that for just the overflow of bodies. And of course, there's been some argument about whether or not the city's actually considering that, but you did have multiple officials saying that, look, in the long run, this is a plan that we've always had and we've just never actually had to implement before. And then when you talk about for where there are funeral services, these guys are all exhausted. They're saying, we're not even sleeping because it's just funeral after funeral after funeral. And we want to make sure that we can do it as right as we can, and that takes time.
Let me ask you, Gran, funeral directors, people who work at morgues, they are essential services, but where are they in the line to receive protective gear?
They say they're at the end of the line, and they say they understand that, right? I spoke to the president of the New York State Funeral Directors Association, and he said, I understand that hospital workers and medical employees need the PPE, the personal protective equipment, but he said, we need it too, and we're the last ones to get it. And to a T, every funeral director that I spoke to said, I still have some supplies, but I am running low, and I can't figure out where I'm going to get the next shipment. You contact the places that sell them, and they say you're now on the list, but there's no estimate for when you might get it. And they're kind of relying on their state association to figure out where to get a very large supply of masks and gloves and all the equipment you see medical personnel wear. And he told me, even my normal suppliers are saying, you're not the main priority right now.
Wow. Well, Graham, thank you so much. There's so many different ways that this virus impacts the way we live, things that we have taken for granted before. Really appreciate your reporting. Thanks.